Eric, let's go to the data report for today. And one thing we would point out, we had trouble yesterday in the system reflecting all the cases. And so it's impossible to determine how many cases were yesterday, how many were today. We had a number that was lower than it should have been yesterday. But I think what is instructive is that the two-day average, which we know is right for those 2 days. We just don't know how many cases in each day, but the two-day average is 8,411. So 8,411 would be the two-day average. Eric, let's go to our alert map slide. As we look at today's advisory system, we have one county continuing at purple, and that is Richland County. Miami County is new to the watch list. Wyandotte County is red for the first time ever. What we're seeing with the advisory system today is similar to what we've been seeing over the past month or so. We're seeing counties move to the watch list, then purple when we're seeing worsening trends in cases and healthcare indicators. And then many times they return to red when these all plateau at a very critically high level. So as we pointed out, to remain at the purple, it has to keep going up. And even if it just plateaus out at a very dangerous level, it will, the way the system is set up, go back to red. So as we look at this map, virtually everything is red. And so while this color code system was very helpful as we move forward a month ago, after we started it, and really told us how the state was moving and what was going on in your county. When everything is virtually red, the importance of it takes on less meaning. So what I, again, would advise everyone to do is look at what's going on in your hospitals. Look at what's going on in your hospitals. That's going to tell you if there's a problem connected with the hospital because of too many people, too many COVID patients coming in. The other thing to look at is what we're going to look at right now. And Eric, if we could go to the next slide. This is our all 88 counties, again, 1 to 88. And the thing that we would again emphasize is if you want to see what the risk is in your community, go to this. Every county, very, very sadly, is at least 3 times over the number of cases that the CDC requires for the county to be considered high incidence. So it's high incidence multiplied by 3. That's the lowest county. And then we have many that are much, much, much higher than that. Let's go to the first 20. This is the first 20, as you'll see at Wyandotte, Brown, Jefferson, and what you're seeing is they're really spread out geographically all over the state now. It's not just in one particular area. And again, if you look at the top 20, you go from 13 times the rate of high incidence in that county down to 9.5 times. So counties, no matter where we go, we're seeing counties that are just, very, very, very high. What's the results? Results are, of course, people get sick. We look at what's going on really in our hospitals to see the results of that many new cases.